Hello and welcome back to Unacademy. So myself, Dr. Muskan Chaudhary, and today we'll be discussing about the recall session of NEET 2021. Right, so microbiology questions will be covered today. And before that, as we know, the Unacademy is India's largest learning platform, and you can both the live and the recorded sessions can if those students who for whom it is difficult to get the live session attend, they can actually see the recorded videos by the topmost educators and can they learn from the topmost educators for the coming medical examination. You can compete in the live T&Ds that has been taking place and test your preparation with your highly competitive quizzes. Study on the device can assess up to 25,000 of the MCQs, right? And soon the printed notes are coming. But as I told you, it was a deal till 11th of September. Those who took the plus subscriptions, it was absolutely printed notes were absolutely given with the plus subscriptions, but now it is available with the iconic subscriptions, right? So Unacademy now has been collaborated with the PrepLadder, and PrepLadder is one of the very famous coaching platform for the NEET PG aspirants, mainly for the its recorded session, this rapid revision sessions, and the QBanks and Unacademy and the PrepLadder together have been collaborated to give you well structured live batches, recorded classes with MCQs, competitive T&Ds, and comprehensive and printed digital notes. And do use my code, that is Muskan 10, to get 10% of the discount on the plus subscriptions and the icon subscriptions, right? And if you take the 4 year subscriptions, mainly for those students who are what in the second year or third year, can take 4 subscriptions, and it will cost you around 60,000 and 75,000 for about 4 year through the icon subscriptions. And if you take 1 year subscriptions, 2 months will be free, and for 2 years 4 months will be free. So it is a great deal by the Unacademy, and it is very cheap and economical when we compare to other online coaching platform. So I request you to use my code, that is Muskan 10, to get 10% of the discount on your uh, NEET PG subscriptions, right? So today we'll talk about what today we'll be talking about the some recall questions about the NEET PG. Okay. So now the first question that we'll discuss today, that maybe there may be some what difference in the language of the questions that has come into the examination, because you know that this is a recall session and the exact language of the question we actually do not know until few days are actually I am in contact with a number of the students, because this is what I have collected from the some of the students that I have talked to. So you can assess the answers just by reading up the language of the questions. Now the patient on the steroids, right? Now the patients on the steroids with nocturnal cough with chronic urticaria. Now, right, and the ball was obtained shows the larva, right? And in the options what was given, one was the strongyloids, other was the antrobius, another was the ankylostoma, and capillaria philippines. Okay, so these were the options in the question: strongyloids, antrobius, ankylostoma, capillary philippines. Now the one thing that we have to see in the question is that we are talking about the steroids. Okay, that is the impaired immunity we are talking about. Next, we are talking about the nocturnal cough. That is, we are talking about the larva migration to that of the lungs, right? So the best possible answer is what? The strongyloids. Okay, and in case of this antrobius, ankylostoma, and capillary philippines, the larva migration is less seen. And when we know that in case of the strongyloids, it is mainly the this immuno impaired person or in the HIV infected people, we see what the larva migration to the lungs, right? And what is here the drug of the choice for the strongyloids is what? Ivermectin. Okay. Now coming to the next question, that a patient with 70% of the burn, that is a history of the burn. Next is a sample that has been collected from the burn site shows the causative agent. That is what? An obligate arrow. Okay. Now, when we talk about the obligate arrow, we frequently read about the mycobacteria, right? And we frequently read about the pseudomonas and the other important bacteria that are obligate arrow. Now, we know that the test that we are talking about here is what? The oxidase positive test, right? And when we talk in the class that oxidase positive, catalase positive test, coagulase positive test, urease positive test, and those important tests are the organisms are very important to remember. So here the history that is important to see is one is of that of the burn history, and second is an obligate arrow. So one of the option was that of the pseudomonas, and we know that pseudomonas is oxidase positive, and it is an obligate arrow, and that the surface pellicle test also we do for the pseudomonas only. Why? Because it has what the it is what obligate arrow, and therefore it appears on the surface with the help of the pili, if you remember. Okay, so pseudomonas is also the most common cause of the burn wound infection. Okay, so oxidase test here we do for the pseudomonas, and history of the burn has been given. So what is the answer? It is the pseudomonas that will be the that was the one of the option, and it is the answer. Now, a child with pharyngitis swab was obtained, which should be discarded in which colored bin? So this is very pretty simple question. That options were given was the yellow bag. Second is what? The blue bag. Okay, white bag and the red bag. So it is pretty simple question that for discarding the swab or the sputum. Okay, we use what? We use yellow bag. Okay. Now coming to the next question, that a truck driver with the painless demarcated ulcer on the penis with inguinal lymphadenopathy, what is best method of motility visualization for the causative organism? So the one hint that is given is about the painless ulcer that is demarcated with inguinal lymphadenopathy. Okay, now we have to see the motility of the causative organism. Now, when we think about the painless ulcer with the inguinal lymphadenopathy, we talk about what? We talk about the syphilis, right? We are talking about the chancre. Okay, we are talking about the syphilis and the chancre, and that is we are talking about the trypanoma. We are talking about the spirochetes. So to check the motility, right? So one option was the dark field microscopy. Another option was the light microscopy, electron microscopy, and one is what? Fluorescent microscopy. ठीक है. Now for the Treponema pallidum, we use dark field microscopy, fluorescent microscopy, and silver impregmentation method, right? But to see the motility, we use the dark field microscopy and the lividity and the Fontana stain for the silver impregmentation for the Treponema pallidum, right? So what is the answer? It is the dark field microscopy. While light microscopy is used to see the bigger microorganism that we use for what? Aurelia. And electron microscopy is used to see what the dead organism or the organisms in the vacuum. So we cannot check the motility of the causative organism. So what is the best answer? That is the dark field microscopy. Now coming to the next question, that a male with the urethral discharge. This was the question that was given, that a male with the urethral discharge. Now what is the most common organism is what? The gonococci or the gonorrhea. Okay, that is the gonococci, that is the most common cause for the urethral discharge. And question related to this has been uh, appeared in this NEET 2021. That is the purulent urethral discharge, and the one of the option was the gonorrhea. So gonorrhea was the option. Now coming to the next question, that is the sixth question. A patient with suspected brucellosis, serum collected sent for the standard agglutination test came negative initially, but after dilution it was positive. Now what is the possible reason for it? Okay, so what were the option? It was the prozone phenomena or the post zone phenomena. Okay, or it was complement inactivation, right? So any of above, it's from my by heart, because fourth option is unknown till now. So what is the best answer for this? क्योंकि अपन यहाँ क्या करें, if you know that अपन जब मेरेक्स लैटिस हाइपोथेसिस पढ़ी थी, ठीक है, तो अपन ने उसमें प्रोजोन फिनोमिना, राइट, जोन ऑफ द इक्वलेंस एंड द पोस्ट जोन फिनोमिना, ठीक है. So what we did in the prozone phenomena, what was there? The antibodies were in excess. Okay, and in the post-zone phenomena, it was the antigen that was in excess, right? And where in the zone of the equivalence, the antigen was equal to that of the antibody. So, what is the catching line here is that after dilution of the serum sample, because on subsequent test tubes we are diluting, and in one of this we get the zone of the equivalence. So after dilution, the test was positive, right? So what is the possible reason? Obviously, it is the prozone phenomena, that it became initially negative, that it was the false negative. It was false negative due to what? Due to the prozone phenomena. Now coming to the next question, that is a female with profuse vaginal discharge, that is we are talking about profuse vaginal discharge, non-itching, and on the 15th day of menstruation. What is the possible reason? So what were the options? Options were trichomonas, bacterial vaginosis, candida, or the physiological. Okay, so what we are talking that we need to see is, one is the profuse non-itching and on the 15th day of menses, right? When we talk about the trichomonas, it is actually what? Green, itchy, fishy odor discharge. Okay, now A question in the question, the white vaginal discharge was also given. I guess that was the white vaginal discharge, profuse white vaginal discharge. In trichomonas, it is green and that too itchy, so trichomonas cannot be answered. In the bacterial vaginosis, also it is gray like discharge and that too not profuse, so it cannot also be the answer. Now when we talk about the candida and the physiological, people might have marked it as candida due to the white vaginal discharge. But what happens in candida? It is itchy discharge with pruritus. Okay, so it is itchy discharge and with the pruritus. So this is also not the answer. So physiological is the best answer. That is a female with the profuse vaginal discharge, bite, non-itching on the 15th day of menses is what the physiological discharge. Now, coming to the next question. Now, as I told you, when we read about the disinfection, that the blood spill management, okay, that is the blood spill management. Now, when we talk about the blood spill management, now what were the option? It was chlorhexidine. Another was the formaldehyde. Next is what the ethyl alcohol and the sodium hypochlorite. Okay. Now, I don't think this is the question that even we need to discuss because it is a direct question. Chlorhexidine we actually use in what alcohol-based hand rub. Okay. And what is the concentration that we mainly use is about the 4%. Formaldehyde we mainly use for the fumigation and for the, we read in the disinfection that the formaldehyde and the aldehydes we were using. Ethyl alcohol also we use for the alcohol based hand rubs, right? In the spirit 70% and the alcohol based hand rubs that we are using. Now, this chlorhexidine is used in the hand rub and ethyl alcohol that we use in the alcohol based hand rub, that too up to the 70%. Right now, blood spills, a direct question that it is the sodium hypochlorite in the concentration of the 0.5 to 1% and up to 5%. If it is the small blood spill, then we use in 0.5 to 1%, and if it is large blood spill, we use up to 5% of the sodium hypochlorite. Now coming to the next question. Now a child with bloody stools, okay, a child with bloody stools and the abdominal pain. Now, what is the enrichment media from the fecal samples? Now, when we are talking about the bloody stools and abdominal pain, we are mostly talking about the dysentery, the basilar dysentery, and what were the options in this? One was the alkaline peptone water, another was the selenite F broth. Okay, so what is the enrichment media? So we are talking about the enrichment media, that is what liquid in nature. So any media that was solid in nature have been cancelled. So now coming to the alkaline peptone water, where we use for the Vibrio cholera. And for the selenite F broth we used for the salmonella and the shigella. So what is the question that is pointing towards the bacillary dysentery? So what is the best possible answer? It is the selenite F broth, right? And that is used for the enrichment of the fecal sample microorganisms. Okay, now coming to the next question, that is the hair perforation test. ठीक है. Now here perforation text is positive. It is also again a direct question. ठीक है. And what is the answer? It is what? Trichophyton mentagrophyton. Okay, so it is again a direct question that hair perforation test is what? Positive in trichophyton, and they will show what? Wedge shape perforations. ठीक है. So it is again a direct question that from the parasitology, that is the hair perforation test is positive in the trichophyton pentagrophyta. Now next question, that a child with blue white spots, ठीक है, a child with blue white spots followed by the rash, right? That is blue white spots followed by the rash. Now we have to find the genome of the agent. That options were what? Options were naked RNA with single stranded RNA, enveloped RNA with single stranded RNA, now non-enveloped DNA with single stranded RNA. Right? So what we are talking about, blue white spot followed by the rash, what is the first thing that will come to our mind is what? Measles. And what are these? Coplicos spot. Okay. And what is the first thing that will come to our mind is what? Measles. So what is the genome? We tend to forget, although the genome, but remember that measles are what? RNA virus. ठीक है. और जितने भी वायरस होते हैं सबके सब क्या होते हैं? सिंगल स्ट्रैंडेड होते हैं. एंड दैट टू एक्सेप्शन वन इज द रोटा वायरस, एंड मीजल्स वायरस इज व्हाट? एन एनवेलप्ड आरएनए वायरस. क्योंकि नॉन एनवेलप्ड वायरस और नेकेड आरएनए वायरस, वी रिमेंबर द निमोनिक फॉर दैट इन अ वायरस क्लास. सो रिमेंबर दैट measles is what? An enveloped RNA single stranded virus. Now, coming to the next question, that is, a bunch of people ate pastry late night followed by the vomiting early morning. That is, after pastry consumption, vomiting early morning, with the history of early morning vomiting. And what were the options? That is, one is what? The Bacillus cereus, another is what? Staph aureus. Now, here it is a clear case of what? Food poisoning. ठीक है. And we have are talking about the pastry, that is the milk. When we talk about the milk and the meat products, pastries, we are actually relatable to staph aureus that we are talking about, because the food poisoning that is caused by the staph aureus is having a mainly have the history of all these eatables, that is milk products, meat products, and the pastries that have been contaminated by the staph aureus, right? And majorly, it is 1 to 6 hours of the this duration, that is after 1 to 6 hours of the consumption of the food. But in the question, it was actually the 12 hours that was suspicion, and that was creating confusion. But the main point here to focus is about the pastry, because in Bacillus cereus is something that is related to the rice or to the noodles. The question will mainly come. So what is the answer here? It is the staph aureus. Now coming to the next question. A patient with the swelling came on the scalp with pus pointing erythematous and erythematous lesion with the petting of a dog. What is the diagnosis? It is again a clear-cut direct answer, that is the chirion. Now coming to the next question, vector for parasite with kinetoplast. Now since whenever something that is related to what a kinetoplast comes, you must come, leishmania should come to a mind. Okay, we are talking about the leishmania, and what were the vectors that were in option? That is the sandfly, anopheles, tsetse fly, and triatomine bug. ठीक है. So when we talk about the kinetoplast, and what is a kinetoplast? It is actually a modified mitochondria that is present in what? amastigate form. ठीक है, and the promastigate form and the amastigate form we talked about. ठीक है, that is amastigate form, A से A, that is present in आदमी. ठीक है, that is present in आदमी with the LD bodies. ठीक है, and what are LD bodies? That are amastigate form that is present inside the macrophage. ठीक है, with the kinetoplast and the nucleus. ठीक है, so where it is found in the leishmania, and what is the vector for leishmania? It is the sand fly, because anopheles is for malaria, CC fly for the sleeping sickness. ठीक है, so remember. Now next question, that is parasite whose microfilariae having a sheath with no nuclei at tail end. ठीक है, and what is the option? One is the Brugia malai and another is the Wucheria. This is what I could recollect. So, parasite whose microfilariae having sheath with the nuclei at the end. When we talk about the Brugia malai, we can see that they are having a terminal and a subterminal nuclei. So this is clear cut, not the answer. And the Wucheria having the sheath with the terminal nuclei. That is no terminal nuclei is present in where? That is no terminal nuclei that is present at the tail end, while you can clearly see that a subterminal nucleus and the terminal nucleus is present where? In Brugia malai. Okay, so this is pretty simple. That is parasite whose microfilariae having a sheath with no nuclei at the end. So what is the answer? It is the Wucheria. Now, coming to the next question, that a pregnant woman, her niece, she contracted what? Varicella in the same house. And she was negative, what? Was negative for the serum antibody for the varicella. What does it mean? That is a pregnant woman, right? Her niece contracted varicella in the same house, and pregnant woman, she was negative for the serum antibodies for the varicella. It means what? She is susceptible to chickenpox. She is susceptible to zoster. She is immune to chickenpox, or she is immune to zoster. Okay, so what is the question here? That his niece contracted in the same house, she was negative for the serum antibody. Right now, one thing is that she is negative for the serum antibody means that she is not yet immune. So she is not yet immune to any of it. Now, her niece contracted varicella in the same house and she was negative for the serum antibody. Now, since the serum antibody she is negative, so she is immune, and yet the infection has not yet taken place for the first time. And whenever the infection takes for the first time in the varicella zoster virus, it is the first that chickenpox will arrive first, varicella will arrive first, right at two in early age. Okay, so it is what? She is susceptible to chickenpox because zoster, it tends to appear late in the age, that is after 60 age, and that too it is a secondary infection, that once the chickenpox has appeared, has taken place in the person has had chickenpox episode and then is having susceptible to the zoster. Now coming to the next question, outbreak of encephalitis in a community to universal immunization schedule, the route of administration for the likely infection, it is what? Killed intramuscular or live subcutaneous? Killed subcutaneous, right? So we are talking about the outbreak of an encephalitis in a community, that we are talking about the Japanese encephalitis. Okay, and Japanese encephalitis, it is what given life. Okay, and the vaccine that is like given life is what subcutaneous. Okay, so what is the answer? It is what the live subcutaneous, because killed is given what intramuscular. Now, coming to the next very simple direct question, that is what? That is the vector for bubo, that is vector for plague is what? Xenophila chopis. That is a very simple question that is directly asked, is what the vector for the bubo. Now, coming to the next question is that a known case of AIDS with productive uh, fever found to have a consolidation in the right infrascapular area, with X-ray showing the lower lobe consolidation with CD4 that is less than 55 per microliter. What is the most common cause for it? It is what? Staph, pneumococci, staph aureus, mycoplasma, or pneumocystic cerevisiae. Although from the question when it comes with the HIV patient, okay. Now, the most common opportunistic infection that takes place is by pneumocystic cerevisiae and the cryptococcus. So we tend to bias towards the pneumocystic cerevisiae because it also takes place, one of the most common opportunistic infection for HIV/AIDS, and also CD4 counts are less than what 200 per microliter, right? But the next thing that we have been asked is that is the consolidation of right infrascapular, while what happens in the pneumonia? It is bilateral interstitial consolidation that is seen, not in just right infrascapular area. So a typical question that is asking right infrascapular area with with lower lobe consolidation, right? So this happens where in the streptococcus pneumonia, that is also one of the most common cause for pneumonia, opportunistic pneumonia in the HIV or the AIDS patient that we are talking about. Okay, so that was it about today's session, because it was a recall session. Whatever I could collect, I tried, and we will having a detailed recall session that will be discussing all the other options, and in not just the correct answer, all the other options in detail and brief in the coming session. And the paper was quite, some questions were very direct, quite easy, and some were a little tricky to mess up with your mind. And the paper was okay, that was moderate level, not so difficult, not so tough, not so easy. So I hope that everyone has done their best and everyone's prepared, was prepared for the microbiology session, and everyone have done their better. Be relaxed and be optimistic. Everything will, whatever is going to happen will happen for a reason, and pray for your results. And I hope that luck will support you in every possible way, and if you have worked hard, your hard work will pay you off soon, right? So don't be in case you have not put your effort in the examination, so don't be disappointed. Sometimes luck is something that can take your ranks higher even if you're disappointed with yourself. So don't be disappointed, be optimistic right now. So see you in the next session. So this was a small session from my side, and see you. Tata, bye bye.